We reside in a system that's composed of interconnected parts related to factors where we live, work, and play. And as practitioners, I believe that we have a shared social responsibility to serve as incubators for social change. And it's our duty to cultivate those equitable conditions in which we live, work, and play by harmonizing the science and art of protecting and improving the lives of people, communities, and populations at large.
Hey friends, welcome to Public Health Careers. I'm Amari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Tyler Jackson. Tyler is Customer Success Manager at MyndYou. He is a multiplier to his colleagues. He's someone that creates long-term value for organizations in the face of ambiguity. He's an expert on enabling startups and larger companies to grow, expand, and retain new and existing business. He conferred a Bachelor of Science in Health Science at Aurora University, a Master of Public Health at Tulane University School of Public Health and Tropical Medicine. In today's episode, you'll hear and learn more about how to leverage the combination of healthcare, technology, and behavior science, why you should take study outside of traditional public health disciplines, and how we can design a better healthcare system, and much, much more. Be sure to subscribe and share this episode with someone. Enjoy.
Hey, this is Tyler Jackson. I am rebuilding the equitable future of health tech, and you are listening to Public Health Careers.
Tyler, I'm excited to hear more about your journey into health tech and how you used your public health degree to get you there, and just learn about that. And very, very excited to hear about your journey. So welcome to the show.
Thank you so much, Amari. The pleasure is truly mine.
Yeah, likewise. So just jumping into yourself, how do you identify, and tell us a little about your personal background?
Yeah, absolutely. I identify as a Black male. I'm a lifelong native of Chicago, Illinois, and I'm one half of a twin duo who knew that healthcare was what healthcare was before I knew my ABCs.
That's awesome. That's awesome. Does your twin still live in Chicago as well?
Yeah, so we're actually fraternal twins. A lot of people like to still argue that we're identical, but he's living about 20 minutes away from me. We're apart, but we're still extremely close. But yeah, we're fraternal twins.
Okay, that's important to be close despite being apart, and I think it's a important theme in like just having community and our family. But that's cool, and I learned something new about you today. So, and I guess in terms of like you said, you're rebuilding an equitable future of health tech. You are at this intersection of public health and health technology, and I want to kind of like lead a lot about that. In digging into some of the work you've done and all of the experiences, I learned about this foundations and design thinking at IDEO. I don't even know how to say that. IDEO,
IDEO, yep, you got it.
IDEO, okay, IDEO. So just wanted to hear like what are some of the takeaways that you learned in this foundations and design thinking, especially for the relevant audience in like public health.
Yeah, so design thinking actually was one of the reasons that I decided to pursue this intersection of public health, technology, and behavior design. Classically, design thinking comes from the design world. It's an ideology that has one purpose. It's to change existing situations into preferred ones. And, it's classically known to drive innovation based on human desirability, business viability, and technological feasibility. So that combination of those things really taught me a lot about how public health is ripe for innovation, especially as we've seen COVID in 2020. And although design thinking itself has lost steam over the last few years, I think it's a great framework to consider when you're thinking about your public health career path, how different products and services in healthcare solve challenges for populations, and how intersectionality is essential to rebuilding our nation's public health infrastructure. Um, the foundations in design thinking itself at IDEO, it was a course. Now, do I think that everyone should spend money into taking the course? I think for most people you don't have to. I think you can get a lot of the principles through Stanford Design School and IDEO, their content. Um, but I will say I think it's important to invest time more so in the broader picture of systems thinking. And one of the books that I read in my courses in my public health studies was The Fifth Discipline, the art and practice of a learning organization. And I think those 11 laws, they fundamentally shape the way I believe we can rebuild the healthcare system of both today and tomorrow.
That is a book that has been on my peripherals, but I've never read it. But definitely glad that you recommended that. And I feel like public health and design thinking they work very much hand in hand in a lot of the ways that they can bring about change and impact that change in like innovative ways and ways that kind of center community and center that voice, which I think is so important.
I couldn't agree more. It's essential, right? Now, if there's one book other than one that we'll probably get into later, I think that's the one to have. I think a lot of people get steered away because it looks like a textbook, but I almost think of it as like a field manual. Is really there's a lot in there outside of what you can use to structure public health for systems abroad that affect public health. There's a lot in there about self mastery and building yourself up, how to take a vision from concept to execution. So, highly recommend it.
And you've developed deep multi-threaded relationships at the executive, clinical, and operations level. How do you do this, and what advice do you have to others?
Yeah, I love that question. And rather than think about it as advice, I like people to think about it, their relationships that they build as a brand. I think it's important to ask that question. How will my customers remember me? The first step is really to curate the capacity to understand humans and solve problems. At the end of the day, whether it's executive, whether it's a clinician, whether it's an operational leader, they all are evaluating projects, products, and services to solve problems. So in the public health world, you have to think about, what do my customers need from me? What is the data? What are the deliverables that I can send to them that allow them to consistently buy into what it is that you're trying to solve. So I think study everything you can about a company's business model, how they get paid, follow the money trail, what's making them lose money, and then also understand what are their near term and long term goals. So once you do that, I think that's how you really cultivate a strong relationship where you can speak at multiple levels depending on the work you're doing, whether that's in a startup, whether that's in a public or private organization. You have the ability to do that. So I think the last thing is understand their personal user manual. Some clinicians, they only care about impacting patient care. So if you try to get into a conversation with them about business and numbers and data, they're not going to care. All they care about is how their patient is doing. So meet them at the level at which they speak. And conversely, if you speak to executive, they want to know the ROI story. I think the patient experience is important to them, but a lot of times they're your buyers. So the conversation is going to have to be elevated to the level of where they are.
That makes a lot of sense, and I love the concept of like relationship as a brand, and like how do people remember me, or how do customers, how do people that are interacting with me remember me, and it goes back to like how do I make people feel when they are interacting with whatever I am producing, as you said, whether that's a product, project, service, or the latter. Um, just thinking about what is it I want people to really understand, and knowing to that point, I guess, what is your audience and how do you make them feel what you're trying to make them feel.
Exactly. If you think about classic public health, not to be reductionist or anything, but at the same time, all of life, whether you're developing a project, designing an intervention for a population of people, you're guiding people through change. It's change management and behavior design. So that's applied to a business model.
Kind of
That's
staying
applied.
on that note, what does public health mean to you?
Yeah, I love this question because public health, I think it has a little bit of a non traditional definition for me. It translates to one purpose, which is do good well. We reside in a system that's composed of interconnected parts related to factors where we live, work, and play. And as practitioners, I believe that we have a shared social responsibility to serve as incubators for social change. And it's our duty to cultivate those equitable conditions in which we live, work, and play by harmonizing the science and art of protecting and improving the lives of people, communities, and populations at large.
Before we get back to the show, are you passionate about public health and looking to elevate your career, brand, and impact? Join the public health community today. Gain exclusive access to career boosting events, connect with like-minded professionals, and stay ahead with the latest trends in public health. Plus, enjoy mentorship and career support to help you thrive. You'll even learn tips and tricks on how I grew my LinkedIn by 2,000 followers in the last 6 weeks. Sign up before the end of May to lock in your membership at the current rate before prices go up. Don't miss out on this opportunity to grow and connect. Join us at thephmillennial.com/join or in the link in description and be part of our vibrant community dedicated to making a difference in public health. Let's build a stronger future together. Now back to the show. I love the do good well, and we are incubators for social change, because that really actualizes it to each and every one of us having a part to play in doing our part to provide that goodness for public health, which I really love.
Yeah, I appreciate it. I think that everyone has such a different skill set that they can provide to public health. So just keeping that at top of mind, do good well at whatever it is you're doing, and we'll always see a better world.
Yeah, and I think, like, going back to like me co-founding Brothers in Public Health, the nonprofit, it is how do we not only like get brothers into public health, but how do we create and show people that they can be change agents in their community in small ways and in big ways as well, because we all need to see that we are the change that could happen, and we can like be a part of that advocacy effort that needs to see that change. So really appreciate that.
Of course. And just a shameless plug to you, you're already doing it. The platform you have here, I think serves as representation of what can be and beyond. And I think that you creating a space where other people can see that there is possibility is so important. So I just want to give uh, verbal and social kudos to you for the work you're doing.
Well, I greatly appreciate that, and I will take all the flowers. So appreciate that a lot.
Of course.
And then getting into your journey, I'm guessing before you know anything about health tech and that intersection of public health, you started off, or you part of your journey started off as a bachelor's of science in health science at Aurora University. Walk us through that thought process and that journey to get there.
Yeah, it's so funny to me because I think about how I never really intended on going to Aurora University. In fact, I started at the sister school of George Williams College pursuing a psychology degree. Back to a little bit earlier, we were talking about I've always been interested in behavior design and the way we think and why we do the things we do. So I thought that, you know, to make a change in healthcare, I would pursue medical school. So I would have all of this understanding about why people behave the way they do and then go to medical school. But things didn't necessarily work out that way. What stood out to me initially was GWC, Georgia Williams College, their mission, which is discover what matters and build your life around it. And it was reflected in different coursework around social innovation, entrepreneurship, and inclusivity, which has some of the most profound influence on how I see the world today. And my big I have a dream idea has always been to build and design my own community health center that blends healthcare delivery, technology, and behavioral design. And I thought the way to do that was I needed to become a doctor. Number one, to secure the resources to do that, but to also fulfill the vision and have the credibility to build a community health center. But once I transferred to Aurora University, I switched my major to biology, and I did it for 2 years until I realized I had like 3 or 4 different plant sizes that were required, and I said, I'm not really interested so much in learning about the anatomy of plants. And so I went to my counselor. I said, "Is there any way I can preserve the existing credits I have while also still studying the things that interest me?" And there was a pathway to do that with health sciences. So all this time I thought I was building a compelling case for medical school. I had been surrounded by doctors since birth. Um, I've always been a science geek, and at the same time, while at Aurora University, I was working as a medical scribe in the emergency department, while also working at the campus coffee shop and in the catering department. And then I also went to Spain, where I shadowed in four different departments in hospitals across Spain. And so I was like, I have everything I need to go to medical school. I got leadership experience, I got work experience, I have all the credits I need. That was until I got to physics class. And I could not pass this class for the life of me. So I got halfway through the semester. I decided to drop it. And during that summer, I started working at the National Student Leadership Conference, where that's where I really first learned about public health through Northwestern giving a presentation about the Institute for Global Health. So that was 2016. And during that time, once I graduated, I decided, I'm going to take a gap year. Like, I got 2 years till I graduate. Let's take a gap year. Let's explore that. And that's when I ultimately went to Kenya, and I went there for 4 weeks and had the opportunity to volunteer abroad. And being able to do that with people from all around the world and understand the difference in public health systems, now that I see America's healthcare system, Spain's healthcare system, and now I'm seeing Africa's. Um, that cemented my love for public health right there.
Wow, that definitely is quite the journey, and definitely wish you all the best in actualizing the plan for like your healthcare center that is a hub for all things necessary for health and improvement of health and behavior change. And I'd love to see how you're able to like just like mold your journey from that early start. And I think it's so important that we do highlight uh that there's always the evolution of, yeah, okay, I want to do medicine, I'm glad that you also mentioned that, yeah, okay, you want to do medicine, you set yourself up to do all the things to become a doctor or to apply and go to medical school, and still you were able to find a path to do work that you said maybe fulfilled more of what you were doing and learning more about public health. And I think about it like, if you didn't take those experiences, if you didn't go to Africa, would you have known about public health, and would you have been exposed, or would it have been something that came later? And it's so important just to like jump on experiences, because you never know like how that really is going to shape the path that you take. And given that extensive journey that you had and learning experiences throughout undergrad, what were some of the big takeaways, if any, that you had?
So you highlighted a point that goes right into my first takeaway about, I had a vision of being a doctor, and then I had these other interests that were coming to earth. So I think the first takeaway is be skeptical about making rigid prescriptions about who you are and who you will be early on. I think it's important to allow ourselves to encounter failure. The second piece I would say is recapture that childlike sense of awe. And for me, I've always been a geek, nerdy into technology, nerdy into science, nerdy into the way the brain works. So I think it's important to also study those fundamentals that build on top of everything, like computers, microeconomics, persuasion, psychology, ethics. And the third thing I would say is, if you can feasibly travel abroad, whether that's for study abroad, whether that's for leisure or any other reason, definitely do it. I wouldn't think twice.
I couldn't agree with those points and anymore. And I think like too often, especially early in our careers, we have that rigid plan or rigid thought of, okay, this is what it's going to be, this is what it's going to be. And it also it comes from a place of like maybe not always understanding what are the options, what are the experiences that you really need to know this is actually the thing that need or that I want to do, and I feel like that's why one of the reasons I started this podcast is just like to share more about public health careers so that people can find out about it before they're 23 like me, and like just be a little more intentional in that path into public health, which I think is important.
It is. It's important. It's beautiful to see that you took the journey you went through, and now you're providing a solution to that. Like I always think about as I've been listening to your podcast, I wish I would have listened to this when I was 13 or 14 because it would have changed everything for me. So again, it's beautiful to see how your platform is really providing such a necessary service for people that want to come into healthcare and make a difference.
Yeah. Well, I appreciate that, and that I wish I had it as well because it would have saved me a lot of time and a lot more direction and getting to where I am today. But our journeys are our journeys, and
Right.
those experiences and misdirections are important and like kind of define who we are. So can't complain.
Agreed.
And after your bachelor's degree, you decided to pursue a master's of public health at Tulane University School of Public Health and Tropical Medicine. So, what was the process going into here? How did you know that like a master's in public health was something that you were interested in? Kind of tell us maybe that thought process of learning about public health and then deciding to go into an MPH program.
That's a great question. So, back in 2016, when I did go to Spain, I was shadowing doctors. It became more of being immersed in a public health system in Spain. Taught me a lot about like why is this so different than America? And 2018, after I graduated undergrad, and I was taking that gap year, and I went to Kenya. I had the same realization, and so I said, this is another way to transform health. There's not just medicine, because that's everything that I saw and that was preached growing up was you have to go through medicine. And so when I was in Kenya, my initial thought was that seeing that there was such a need for medical devices, I would join a medical device company that had a public and global health initiative that would allow me to go back and provide the necessary supplies that they needed. So that led me to join Medline, where I ultimately was there for over 3.5 years. But during that time span, it was a little bit different than what I thought it was. Again, that goes back to not making those early prescriptions. And 2020 came naturally with COVID going on. That just told me that's the signal to go and study public health. Like I've had these experiences. I keep finding myself in these situations where I'm discussing populations, I'm understanding different way people behave and why they do the things they do. This is it. So I saw that Tulane also offered courses in social innovation and entrepreneurship and health equity, social and behavioral health sciences, things that I love. So to me, it was a no brainer. I connected with a recruiter about the application process. And this is also a shameless plug to Tulane. There was no GMAT required. So that was also a big guiding factor. I didn't have to take an entrance test. It was just based off of the application process. And I think that, while the coursework and everything was great, the professors were incredible. I saw that Tulane also had a Change Maker Institute, which is a social venture accelerator program, which, that in itself, being able to be surrounded by a group of visionaries that want to build and develop different services and businesses and interventions that impact healthcare, society abroad, that ultimately drew me there, where I spent my next 2 years.
And I love hearing the going to Kenya, learning about like the gap or the need for medical devices and kind of like thinking about things from that perspective while also thinking about, okay, how can I get this master's of public health? But I don't only want to learn about public health. I want to learn about the social innovation type of things, and finding a school that kind of matched with that, I think is important. And too often we kind of limit ourselves or maybe we don't reflect enough to think about what are all the things that we do want in a program. And I think especially in this economy, you have to be very intentional in this kind of
Yes.
investment and really, really understanding what are all the factors that make this program the program that's going to make me or give me the best opportunity to be successful going forward. I think is so important. And even in you like knowing about this, you didn't know about the Changemaker Institute, and like just you're still able to go in there, learn, build, and just see and build, I guess, more of an ecosystem around these public health tangential or like things that intersect with public health in a way. So I think that's really cool for you to highlight.
No, I really appreciate that. And I think you said it best is I was always searching for this ecosystem. I wasn't just looking for like a point solution, like just one rigid way to make a difference because the way the world is going, there's so many different aspects that intersect. And why not bring that to public health if we're going to be responsible for taking care of populations at large?
And maybe what were some of those innovative maybe thought processes or lens that you kind of like gained while you were in your MPH program and kind of like part of these different communities?
I think the one thing is how technology can accelerate innovation. I think we all know historically healthcare is very slow to adopt new technologies, but I think COVID kind of became the accelerant for that.
And I appreciate you sharing all about your MPH experience. What were some big takeaways that you would want to share with us?
There's two. I think the first one is unapologetically discover the intersection of your interests. For me, it's the blend of healthcare, technology, and behavior design. For someone else, it's something different, and I think you should explore that. The second thing is to find professors, mentors, and peers that'll challenge your thinking and seek out the right questions rather than the right answers. I think it's easy to get caught up in the idea that we need to have answers to anything, but with the right questions, it can put you in positions and opportunities that you never even thought about before.
And then coming out of your Masters of Public Health program, like what was your thought process on what the next steps of your career ideally would have looked like?
I when I came out of the program, I knew that I wanted to work in a health tech company. I knew whether it was going to be somewhere like GE or somewhere where there's a huge footprint or either a small early stage startup. I knew that was the direction I wanted to go. So I spent a little time reflecting on why I love Tulane so much. And it was because of that small cohesive group. And to me, I was looking for that challenge to grow myself and honestly kind of get an MBA on someone else's dollar. So I decided to join MyndYou, which is what at the time was a very early stage startup, less than 30 people, maybe even less than 20 at the time, and it's been a life changing experience. Being able to be surrounded with a group of technologists, a group of clinicians and public health practitioners, all under the same virtual roof.
Yeah, absolutely, and I know we've had one of your coworkers, Tali Segev, on a previous episode. I'll be sure to link that episode in the show notes for anyone that's interested. Um, but how did you like learn about this health tech field, and then how did you learn about MyndYou, it being this small startup?
I will say, funny enough, I believe I was subject to the algorithm, given that at the time, given at the time I was in the social venture accelerator program, and so my idea was to improve the Medicaid population. So I was trying to build an idea where you would build on top of an EHR to improve billing for physicians that serve Medicaid patients. Because as I studied that population, I saw that there's care disparities because of the reimbursement issues. So I was trying to figure out a way to solve that. So naturally, just studying and researching all of those different things led me to, I think, coming across a bunch of different health tech companies. And naturally. Learning about AI a little bit more, I learned that MyndYou had a clinically trained AI bot, and I said, that's interesting. It reminds me of, if you were to call your bank or you would call any service, personal service that you have, there's a trained bot that speaks to you. And so I was like, what does this look like in the healthcare sense? And I was actually initially interested in Tali's research that she did of U of I, and we had a great conversation. And after that, she told me about the role that was opening up, and the rest was history from there. But learning that you can train an AI bot clinically to outreach to patients just told me that's the essence of health equity, meeting patients where they are, because we're contacting them all through something that 99% of us have, and that's a cell phone. So once I saw that, I knew that there was an opportunity to make an impact on a variety of patient populations.
And going from having those conversations with Tali and her sharing that there's this position, and was that the customer success manager position?
Yes, it was. That was the customer success manager position. So I've been a customer success manager for a little over 2.5 years now.
Okay. So looking back on getting this position and the experiences you had throughout your bachelor's MPH program and the social venture program, like what are the things that really set you up to get a job in health tech, you think, and get a job as a customer success manager? Because I feel like this is I feel like we don't have enough conversations about public health and tech and how
Mhm.
people can think about using a public health degree in tech. So just trying to like help people think through that so that if they are interested, they kind of have like a means of, I don't know, actioning on figuring out what's the next step in health tech spaces.
Yeah, that's such a great question. And I would say the number one thing is to always talk about what you love. At the end of the day, you may not have something specifically you want to request from someone. You may not know what you need to go and ask someone help for, with with for help. But always tell people what you love, because that's always casting the thread out into the world, because you're saying, this is who I am, this is the impact that I want to make. If there's anyone else that you come across in conversation that I think you should meet, then please introduce me. So in the world of health tech, or let's just say public health first. When we think about public health, a lot of people think you need to work at a public health department. You have to do something very not very traditional. But there's so many startup companies out there. I think Rock Health is a great resource where you can discover up and coming companies. Read all of those healthcare publications that talk about top 50 digital health companies and things like that, and start to say, where do my interests align? Am I interested in women's health? Am I interested in care delivery? Am I interested in revenue cycle management? Because there's a company out there for all of that. So lean into those interests and then use what's already out there. And the biggest, the number one thing that I recommend everyone do is the network, network, network. I say that and I still don't do enough of it, but none of these doors would have opened up if I didn't talk to people about what I love and continue to put that message out there.
And then what are some of the main responsibilities? What do you do as a customer success manager? Like, what are your main responsibilities? What's your day to day look like?
Yeah, absolutely. So my main responsibility is to manage the business relationship between my company, MyndYou, and then our clients. Our clients are typically health systems and health plans, and then we also have a thread of strategic channel partners. So my job is to, number one, understand my customers' business objectives. What is the ROI they're expecting out of our AI trained our clinically trained AI chatbot? So I'm designing the use cases in which the health system or the health plan is deploying the chatbot in order to make a difference in the patient population. So that can be anything from patient experience surveys, from a post-discharge program after patients get out of the emergency room, or after they've been admitted to the hospital. There's you have a 7-day time frame that you want to make sure that patients are getting the help that they need, so our chatbot can perform that service. And all of that is giving power back to clinicians to do the human intervention. You don't want clinicians spending time trying to call patients and spending 6-7 hours doing that and not being able to connect with anyone. You can outsource that to our service, and then at the same time, whenever there's a clinical need that's detected by AI bot, we transfer that into the care team, who then does what they do best, and that's take care of humans.
So really like ensuring that clinicians are working at the highest area, what they call it, rung of expertise, so
Yes.
so that they're really using the skill sets that they are trained for, and not having to do like more maybe administrative type tasks.
Exactly. So the goal is that you hear a lot of conversations now in health tech. We have to find a way to replace nurses because the challenges. That's never the case. We don't want you can never nurses will never be replaced. Humans will never be replaced. But what we can do is take away some tasks that are low level, that are non-complex, and allow humans to practice at the top of their license. Let clinicians do what they do best and what they're trained to do, which is take care of their patients.
And I kind of want to dig a little bit more into how did you develop that skill set around like managing business relationships, and yeah, tell us more about that, or what does that
Yeah.
look like for you?
So again, not to be reductionist, but I think that about 90% of the time you can separate your stakeholders into three levels. You have your clinical stakeholders, you have your operational stakeholders, and then you have your executive stakeholders. Your executive stakeholders are the ones who have signed the contract that says we're spending money on this product, on this service for this outcome. You have your clinical stakeholders who are saying, these are the patients that I need to take care of. Here are the services I'm going to provide to them. And then you have your operational stakeholders who say, I'm responsible for making sure that this project is running appropriately. Everything that a vendor, let's say like MyndYou, is performing, I'm responsible for making sure they get the patient list, making sure that patient information is accurate. So it goes down to understanding. It comes down to understanding their needs. Executives typically will want just high level overview of where they're going, how is it impacting the bottom line. Clinicians want to know, how is the patient experience, how are patient outcomes being impacted. And operational, they want to know, are you making me a rock star in my organization? The executive above me signed, and I need to make sure that we're on track to make the progress that will say we're going to purchase this product or this service again. So delivering that value and delivering what is expected on time and at the right frequency, at the right channel, is essential.
And one thing that I think is like so important, especially when you're looking to maybe go outside of like traditional public health, is kind of like leading the language of the work, because a lot of what you just shared is very public health based. Is like, okay, we have these different communities, the
Mhm.
executive, the operations people, the clinical people. What are their needs? What are the things that they really need to succeed? And how do we support in getting that need met? And I think this is how we have to continue to think about the skill sets that we have in public health, and how it kind of like translates to different things outside of public health, because that in itself is very important. And just being able to speak to how you can take that skill set and translate it and be successful. And I believe Tally said in our interview that like, if you're in public health and you're looking for a health tech job, look for customer success manager positions, because
Mhm.
you'll be able to kind of take a lot of the skill sets that you've gained in public health and transfer it over. You might have to learn and change the perspective and the lens that you're using a little bit. And even going back to like how you're talking about like designing surveys and these kinds of things, which are also things that you learn as a public health practitioner. So I'm glad that you were lifting up these kinds of things.
I can agree more. Like look at customer success, look at customer experience, look at patient experience. There's a variety of positions in hospitals, healthcare organizations, and private companies and startups that have each of those roles. Even if you want to look, primarily what we're seeing a lot of is an innovation arm in hospitals. So
Hmm.
hospitals and health systems are building out their own venture ventures within the system itself, where you can go in and design programs. All of our public health education is about program and project management. That skill set can apply anywhere if you want to start to infuse healthcare and technology together. And if you already have the knowledge and the expertise to understand a patient population, knowing why they're responding to certain interventions versus why they don't. So, I think a lot of people start to say, I don't know if I could do a lot with a public health degree, but if you just expand that mindset a little bit, there's so much potential of what you can do.
Absolutely. And coming into this role, what in your mind or reflecting on it was most challenging for you to kind of like get a grasp of?
I will say the most challenging piece was the amount of freedom that I have. I came from Medline where, it's a 10,000 plus employee company where
Hmm.
everything is standardized. Everyone knows do step A to Z. And then, you come to MyndYou and it's kind of, in a great way, you just have a lot of freedom to how we design programs, how we make changes, the data that we present, the things that we can do. So I think taking the top off and not having really any constraints on what we can do and what we can build was a little bit challenging for me at first, because you're coming from an environment where everything is already set up, and now you come to you come to a startup and you're building from the ground up. That was definitely the most challenging piece.
And what has been your favorite part of working at MindYou?
So my favorite part about MyndYou is working with my colleagues, and I don't say that lightly because we all have one mission. How do we elevate the voice of every single patient possible? So whether that's the clinicians at our company, whether that's our public health practitioners at our company, whether that's our research and development, whether that's our sales team, our marketing team, we all have that one common goal, and the patients are at the center of all of that. You hear a lot of talk about patient centered technology. That was the one thing I said is an absolute must for the next company that I join. And MyndYou provides that to me. On top of, I said, I was talking about earlier, the freedom was the hardest part, but the ability to experiment. I think healthcare is, we're just last to adopt technologies, to adopt this idea of experimenting and trying new things to improve patient care. So I knew I wanted to be a part of a company that was willing to step out on a limb and say, hey, this idea may be a little bit crazy, but we're going to try it and we're going to see how we can impact healthcare. And that's what we're doing every single day.
Love that. I love that. And it's always good to be in a space and on a team that you really resonate with the mission and you all are all on the same page on the work that you're doing. It definitely does bring some semblance of like harmony to your life in a sense. So that's
Yes,
awesome.
absolutely. That's one of my favorite words, harmony, actually. So I'm glad that you picked up on that.
Yeah, and tell us maybe a little bit more about how do we rebuild an equitable future of health?
We have to do it together. It's not going to be one person. It's not just going to be medicine. It's not just going to be any single source that's going to rebuild an equitable future of healthcare. It's going to take all of us that wants to do one thing. We all want to do good well. So whatever that discipline is that we all practice, for me it may be customer success, for someone else it may be data analytics, for someone else it's teaching others about potential public health career paths. We need to do it to the best of our ability, because at the end of the day, we all grow better together. And if we want to build the equitable future, it's going to take everyone operating at the top of their skill set.
I appreciate you sharing that.
Of course.
That's some awesome insights there. And before we move on to like the Furious Five, I did want to ask you about. So you're a member of the Outlier project. So I just want to kind of hear more about that work and yeah. So feel free to share.
Yeah, it's so funny. So the founder of the Outlier Project, Scott McGregor, who I'm going to give a shout out to. I think everyone should be connected with him, even outside of public health. He interviewed me for the current role as customer success manager. So after I interviewed with most of the internal team at MyndYou, Scott was like one of the last people that I spoke to. And the first, we had two interviews. The first one was very much, focused on what impact can I deliver to MyndYou. And the second one was kind of more getting to know me, understanding how it would be a culture fit. And, I'll never forget Scott sent me like 4 or 5 books in his series called the Standing O series. And I love those books. And he, ultimately became a mentor for me. And he gifted me a membership to the Outlier Project, which is a community based on extraordinary people from all different disciplines. And he really became a mentor to teach me how to network and the importance of building those extraordinary relationships. So they have a bunch of virtual events every single week where it's different people. You have Olympians, you have authors, you have top business people that come and speak to the group of outliers, and it's nothing short of amazing.
That's awesome, and I can imagine that you also impressed him in those conversations for him to to build that mentor mentee relationship as well.
I appreciate that.
Yeah. Of course, of course. So, where can people connect with you, and where would you like to see yourself in the future?
Yeah. People can definitely connect with me on LinkedIn at Tyler Jackson MPH. You'll find me there. And where I see myself in the future is really building out this crazy ship that we're building at MyndYou, being able to take patient populations and make change, whether that's in health systems or in health plans, and making sure that every patient gets the care they need when they need it, all through a phone call. That's to me true equity in healthcare.
And now moving you on to the Furious Five, the five question that I ask all guests.
Perfect. Let's do it.
Number one, what advice would you give to a student trying to pursue a career in public health?
Explore beyond common advice or prescriptions that other people make for you. If it requires someone else permission to do it, I would say think 3 times before you make that commitment.
If you're talking to someone wanting to get into your position, what advice would you give them?
Take risk early in your career. It's a lot easier when you're younger to take those risks and make a bet. And if obviously don't win that bet, you have a chance to keep going. But if it seems scary, you're right where you need to be.
Number three, what's something you are working on improving in your life right now?
I'm working on improving my storytelling skills. It's the one skill that I consistently get signals that it's the gateway to continuous improvement, whether that's through writing, whether that's through speaking, and it offers a lot of growth opportunities.
Number four, professionally, do you recommend anything?
I'm biased when I say this, but everyone has to watch and listen to the one and only Public Health Millennial podcast. If I had to pick a second, it would be my all-time favorite book. It's called Anti-Fragility by Nassim Taleb.
That's a good one. And why would you recommend that to someone?
I think that book encompasses how we can think about the world and systems and how we can get better in the face of change. And that's what healthcare needs. Right now, we're at a time that's ripe for change all across the world. And despite how challenging it may be, we need to cultivate the mindsets and the skill sets to get better, even beyond what's happening right in front of us.
Number five, if there was one piece of advice you'd give to your younger self, what would it be?
It would be one question: what does the world need that you are uniquely qualified to offer?
That is a great piece of advice to give to your younger self or to anyone younger or anyone at any age. I feel like is important. So I'm glad that you highlighted that. Tyler, thank you so much for hopping on today and sharing your journey. It was a pleasure to learn more about your work and how you really got involved into this intersection of public health, digital health, tech, and innovation. So thank you so much once again.
Likewise, brother. It's been nothing short of an honor. The pleasure is truly mine. Thank you for having me.
Yeah, pleasure is mine as well. So, housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like if you're watching it on YouTube. Leave a review and share it with a friend. It greatly helps the show get out to more people. So, I appreciate you all. Peace and see you all next week.